Ladies and gents, welcome back to The Point, and I'm your super host, Sebit Gordon. And today, how do I say, I have a beauty with brains. And this particular episode has been sponsored by lack of apples being the market. So, an apple a day.
Keeps the doctor
But
away.
today we have the doctor. It means we didn't get the apples today, man. So we have doctor.
Diana.
Yes, I know I will not give her justice if I tell her because her CV is too huge, just like PLO, like you have, 30 minutes, but I'll later summarize it for her.
All right. Hi, guys. My name is Dr. Diana or Dr. Nyanbuot. I'm a specialist in psychiatry. And yeah, I've worked with different hospitals, Aga Khan, um, Chiromo Medical Center. And it's a pleasure having to speak to you about a thing or two on mental health. And I hope many people get to learn from this show.
For those who don't know her, by the way, she's my long-term friend, and yeah, and today I brought her on a different angle. So we tackle a topic that most of us are afraid to tackle, that is matters health in general. And when we narrow it down, it's mental health. I want us to know, like, when people talk of mental health in general, uh, first, what is mental health, Kwanzaa?
I can say mental health is a state of well being, just
Okay.
like health. If you're in perfect health,
Uh-huh.
it means that your well being is okay, physically, emotionally, mentally, in all aspects. So, mental health is just like any other health system, just like
Yes.
physical health, emotional health. That's it.
Okay.
Yeah.
So, it's is it the most paramount? Like, what do you call it? The most important, or is it physical health? Because, like, people don't know what do you call it, but it's as important as other.
I'd say when you look at health, it's holistic in nature. It
Uh-huh.
has different segments,
Uh-huh.
just like it's divided into three parts: physical health, mental health, and emotional health.
Okay.
So none is less important than the other.
Okay.
Yeah.
So just to have a look or now make people understand, like what are the types of mental health illnesses or disorders that we know,
All right.
because I think people might have only perception that depression is the only known kind of
Exactly.
mental health illness.
Yeah. So when it comes to the types of mental illnesses,
Uh-huh.
there are different types. It's very broad. The way illnesses are there in hospitals. There's diabetes, there's hypertension, there's cardiac issues,
Uh-huh.
different issues. So it's the same with mental health. So for mental health, we have different mental illnesses that are categorized into different parts. The mood disorders,
Uh-huh.
the eating disorders,
Okay.
sleeping disorders,
Oh.
neurological disorders. So when you go to mood disorders, you'll find things like bipolar disorder,
Okay.
schizophrenia,
Uh-huh.
and depression,
Okay.
anxiety. Those are mood disorders. When
And
you go
stress.
to also stress,
Okay.
yeah, it's a mood disorder. When you go to eating disorders, you'll
Uh-huh.
find things like anorexia, bulimia nervosa, and others. When you go to sleeping
Okay.
disorders, you'll
Guys.
find sleep apnea
Okay.
and sleep paralysis and others. There are many, I can't mention them. And then when you go to neurological disorders,
Uh-huh.
you'll find things like autism.
Okay.
Yeah, you've seen children who have
Yes,
autism.
yes,
That's a
yes.
neurological disorder,
Uh-huh.
which is a mental illness.
Mm-hmm.
You'll find different diseases like dementia and other things. Mention them.
So, what is the difference between being depressed, being sad, and being stressed?
I'd say there are stages. I'd define them and place them in stages
Okay.
because before you get depressed, it starts with sadness, right? So you have to be sad because maybe something has upset you, or maybe something happened in your life, something tragic. So it starts with sadness, then it goes to anxiety. Then, when you experience anxiety over a long period of time, it turns into stress. When you're stressed over a long period of time, it elevates to depression. So, those are stages, I can say. Yeah.
So it depends on the stages of,
Yes.
but there's this narrative like sadness and happiness are almost the same kind of moods. So if being too much happy also a disorder?
Yes.
Huh?
Yes, it is. It's called hyperactivity.
Oh, okay.
Yes.
So you can't be too much happy.
Yes. You
Uh-uh.
know, like they always say, too much of everything is poisonous, right?
Oh, okay.
So people who have the hyperactivity disorder, what happens with them is,
Uh-huh.
you know, like in their brain, we have neurotransmitting chemicals. We have dopamine and serotonin.
Okay.
So the dopamine is the happy chemical. So when you're
Oh.
happy, a lot of dopamine is secreted by the neurotransmitting chemicals in your brain.
Okay.
And to regulate that, the serotonin has to come in and be produced in small quantities to regulate the amount of happiness.
How do we find out that balance between
Between,
being too happy and not and trying to not be too happy?
I think your brain is what controls it. Because for people, it depends. For people who are hyperactive, it's hard for them to find the balance. But for a
Okay.
normal person, it's very easy. You can decide when to be happy or when to be sad or when to regulate it.
Okay.
Yeah. But for
So
them, it's
so
difficult.
for the people like us who like watching like the comedy shows and so we need to regulate them.
I'd say happiness is a good thing.
Oh,
It's good
okay.
to be happy.
Okay.
But the problem comes in when your brain is not able to release the serotonin.
Okay.
Yeah. But happiness is a good thing.
Okay. Okay. I didn't know. So you've talked about those stages. So at what point now do you think like a person should seek medical help?
So there's a very thin line between physical and mental illnesses,
Uh-huh.
but they're all in the same bracket. Because, for example, with malaria, you get malaria, right?
Yeah, yeah.
When do you feel like you have to go to the doctor? When you start experiencing the signs and the symptoms.
Yeah, correct.
So it's the same with mental illnesses. The moment you experience those symptoms, you have to go to the doctor. Because what happens with mental illnesses is the moment they're detected at a very late stage, it becomes very hard to control,
Okay.
just like any other illness. So the moment you detect something is off about you, from your mood, from, for example, a person suffering from depression will not indulge in the activities he or she used to indulge in before.
Okay.
What used to give them the adrenaline rush doesn't give them that feeling anymore.
Anymore, yeah.
So you see, like when you feel that way, when you experience that symptom of lower mood and, you know, like changes in your mood, you realize and you say, oh, I have to see a psychiatrist, I have to see a counselor, maybe something is wrong with me. Yeah,
So in short, it starts like with self-diagnosis.
exactly. Yeah.
Then now, or someone else might notice and like, hey, you're not good.
Yeah, but you know, like I'd say, like there's no better person who can realize something is wrong with you as an individual other than yourself. So it starts from within. If you feel like something is off about me, go seek help. The
Okay.
same way you feel like you're vomiting, you have signs of malaria. So the moment you experience those symptoms, you go to hospital, right? It's the same thing with mental illness.
Uh, if now you're being diagnosed by a professional, yeah, sometimes it's through therapy, and some people are also given what do you call it? These drugs.
Antipsychotics.
Yes, antipsychotics or antidepressants. Do those pills do they really work? Like, or is it like conspiracy of the pharmacists to keep selling the drugs?
They do work
Can I go to
100%.
today to a pharmacist and say I want antidepressants and they
No,
give me?
no. The thing about antidepressants is this.
Yeah.
They can only be prescribed by a doctor, a psychiatric doctor or us.
Okay.
Because the thing about antidepressants is that they work with the brain, you know, and they try to fix your neurotransmitting chemicals. So it's very complex in nature. So when you go to any pharmacy, you can find them selling anti-malarial drugs or diabetes drugs or
Yes.
hypertension drugs, like they can just give you even without a prescription. But for antipsychotics, it's very difficult. Yeah, but they do work. I know that for sure because I've worked with many patients and I've seen them recovering. Yeah.
And talking of these mental health disorders, yeah, are they are they genetic, or are they how do I call it, uh, caused by habit, or are they of personality issues?
Okay.
Uh,
I'd like to give you an example. Look at diabetes, right?
uh-huh,
Diabetes can either be genetic,
uh-huh,
caused by habit, or other issues. Because when you are diabetic, for example, maybe your grandma was diabetic, so you inherit it. When you're diabetic, maybe it means that you used to take a lot of sugar and all these things, so it caused it. So the same way, mental illnesses can be genetic, they can be caused by habitual tendencies like smoking, taking drugs, and different lifestyles. Yeah.
I can see my director here is is one of those guys who believe in theories, and he believes in theories, and yeah, like they say, this saying, how does it, like, by Seneca, he once said, like, we mostly suffer in imagination than in reality. Like, how is this particular saying um, in relation now to mental health issue? Like, how can you decipher it?
Okay. I'd like to say that many people would rather suffer in silence with the mental illnesses than see a doctor because that part of reality, that fragment of reality is too harsh on them. But when you look at mental disorders, I'm
Yes,
telling
yes.
you, mental disorders are not a fragment of
Uh-huh.
they're not a tale or they're not things that are just heard of. They exist and people are suffering out there. But what makes mental illnesses so unique is the fact that before you realize that you're not okay, you'll have symptoms that are close to that of living in a world of fantasies. Because most patients with schizophrenia suffer from hallucinations.
Okay.
So by the time you realize, like, for real, these are not just my imaginations,
Uh-huh.
it's really a bit late. So I'd say that mental illnesses are serious. They're very serious, and you need to take them seriously. Yeah.
So that takes us back to the society on its belief to mental health and so on. Like, let's come back here in our society. You know, like, men really don't open up to about issues disturbing them, or so on, for maybe being called weak. You can see there are so many memes online, yeah, same, mwanaume nukaa ngumu, and so on. Like, how are these things now, now in relation, you as a medical doctor, how how do you see them?
I'd say the contrary to our beliefs in our field, because when you say, for example,
Yes.
the society says that men shouldn't cry,
uh, yeah.
we're human beings, and part of the mechanism as a human being is crying. When you cry, apparently, according to a study, you release endorphins, which make you feel good, right? They relieve your stress. So that notion that men shouldn't cry, I really don't agree with it.
I think, like, crying is more of sadness. Is it not more of sadness? Now
Crying is
it's
an expression.
like, according, like, to my school of thought, is like, now you are promoting sadness to the next level now.
No.
Huh?
According to us doctors,
Uh,
crying is an expression. You're sad, yes, but what do you do about it? How do you relieve yourself from the sadness? It's the same thing. It's a coping strategy from stress, you know. Some people cry to relieve their stress. It's the same way you'd go to the gym to release your stress. It's the same way someone will exercise to release their stress. So crying is not a bad thing. It's really healthy.
So my school of thought has been deconstructed
Yes.
medically. Yeah, but we are there to review it in a few. So, Doctor, you are actually saying like the societal beliefs and these other philosophies, like the contrary to your approach of diagnosing like mental health. Because for a long time I thought like philosophies like stoicism, they help someone like manage the emotions really well. But now I'm getting a contrary opinion to you.
Okay, what I'd say is everything has merit and demerit.
Okay.
Everything has a downside and an upside.
Uh-huh.
So it's the same with the beliefs and the societal ideas, the stoicism. Um, but what I'd say is most people will rather rely on the stoicism and the ideas than see a psychiatrist whenever they're faced with such issues, and that's where the problem comes in.
Okay.
So what I'm trying to say is everything has a merit and demerit. Yeah.
Okay. Now, talking of society, like you can see like managing of these, what do you call it, emotions. When now it comes back to gender, which gender do you think like manages the emotions well? Yeah. Yeah.
First of all, let's say men hide their emotions a lot
Yeah.
due to the societal stereotypes that men shouldn't cry. You saw the Twitter threads that
Um,
Mwanaumini.
instead of crying, so unaingia kwa swimming pool.
You had.
Yeah, you get your eyes wet.
So that's where the issue comes in.
Yeah.
Women and the female gender are better at handling the emotions than men because they express themselves. You know, like when you see women and men, when you compare who has a higher EQ, emotional quotient, you'll
Yes.
realize that most women have a higher EQ compared to men.
Okay, maybe I've been having a wrong thought. I think men understand like they have, what do you call it, emotional intelligence. I'm a quotient, yeah, better, because you see like men, they can just be like, hey, you guy, man, I can see you're getting fat, yeah. And they'll laugh at it, and then like, okay, I'll hit the gym tomorrow. But if you tell like a woman such statement, it's like now it becomes body shaming and so on. So um, in this case, who's managing like
No.
the emotions well?
Okay, when you look at it, try and look at the aftermath, right? The woman will express herself there and it will finish there. What about the man? He'll go and he'll keep
Yeah, he'll
thinking
work on
about
it.
it,
He'll work on it immediately.
but he will think about it. It
Now
will
it
bother
makes.
him to some
Uh-huh.
extent. Do you know what having a high emotional quotient is?
Yes.
The ability to express your emotions without hiding them within yourself. What men can do is hide their emotions, not manage them. You know, there's a
Men
difference.
accept to this in this what is it called, in this case that I've given you, this case study, like men will accept it, like, hey, yeah, you guy, man, you've told me the truth, like, I'll hit the gym tomorrow. That's acceptance, and you will work towards it. But now to women, now that will be a total different conversation. Yeah.
Okay, I got your points, but when you look at women and men, they're built differently. You know, you can't say that men are the same as women and women are the same as men.
Correct.
They have a different biological comportment,
Uh-huh.
emotional, and they're just built like that, so they
Correct.
can easily express themselves. But the question of the EQ comes in on how to manage your emotions,
Okay.
because most men really hide the emotions, and it just keeps on piling up and up and up, right?
Uh-huh.
So the moment it reaches a point where they can't control it, all the things that have been hidden in the subconscious come up, and it becomes an emotional outburst. That's why you find many men resorting to suicide, and the number of men who commit suicide, it's at a very high rate as compared to women.
But right now it's almost the same now.
No, it's a bit higher
For men,
because
yeah.
of two reasons. First of all, men don't express themselves easily, and second of all, the the ways men resort to ending their lives they're very ruthless. A man can just decide to kill themselves by shooting themselves or hanging themselves. That way you can't be saved easily. But a woman might resort to taking pills or a softer way. That way they can be saved easily. So that's why you find like the number of men who commit suicide is on the high.
Okay, now this takes us back now to takes us to like generations. Like we have like the Gen Zs, millennials, and so on. So who do we think like are managing like the state of mental health well? Like because millennials are very reserved and they can cope with pressure. But now you can see like a Gen Z quitting job and say like, this does not bring good vibes. Yeah, it's not good for my mental health. Anyway, I quit. Yeah. Uh, so are they the ones? Are they the generation now who are more active in, let's say, proactive in these in regards to mental health?
Um, I'd say when you look at the millennials, you look at the community and how they used to live in a setup of friendship, in a setup whereby you could express yourself. There are so many activities which could keep you engaged, right?
Correct.
But these days, it's only you, yourself, your phone, which is very toxic. You don't talk to people. So the Gen Zs are not managing their mental health well. I'd say, like, when you look at the rate of
I don't think the one who are
suicide,
talking much about it now.
they're talking much about it, but they're not doing anything about it.
Oh, okay.
Yeah,
That's the difference.
that's the difference. You know, like, actions speak louder than words. So they're just talking about it, but they're not doing anything about it. Because you can find uh, an activist, a mental health activist, talking about mental health. And when you look at them, the last time they went to a psychiatric doctor was never. So that's tricky.
Okay.
Yeah. And again, when you look at the rate of suicide cases from the way back and right now, there's been a very high, huge influx. Because according to World Health Organization, imagine in just 1 second, 3 out of 5 people take their lives by suicide.
12 of 5.
Yeah.
Okay. It's very alarming.
Very. And again, when you look at the Gen Zs, how do they manage stress?
By letting them like they're very frank on their feelings.
But what do they do about it
Okay.
afterwards? The thoughts. When they go back to their houses,
Okay.
the thoughts. What do they do about them? They just drink or they smoke, they abuse drugs.
Okay.
And that's how they manage their stress, which is very toxic.
Are those drugs in a street way antidepressants?
No.
Okay. But
You can't,
trying
okay,
to reduce
people
the stress.
can term them as that, but there's no way you can call a drug that harms your body an antidepressant.
Okay.
Because what drugs will do, what alcohol will do, what cigarettes will do, they'll just take away the stress, yeah? They'll give that high feeling for just a few minutes. But what are you doing to your body? What are you doing to your brain cells, to your liver at the end of the day? You'll end up at a rehabilitation center. You'll end up with cancer and other things.
Okay, now this takes us to what is the, what do you call it, the systematic approach now to in regards to mental health, like in this scenario, like a person who is maybe caught attempting suicide, should he or she be sent to prison, or should be taken to a mental facility?
According to me as a doctor, I think they should be taken to a psychiatric hospital or a rehabilitation center.
Okay.
Because taking them to a prison won't help them in any way. Because they're not in the right senses. They need help. Yeah?
Okay. So you actually like suggest like those laws should be
Yeah, they should be
changed in a way.
changed.
Yeah.
Exactly. They should. Because again, when you look at the Mental Health Act, the last time they looked at it was some years back. And the country doesn't really care about these laws. They don't care about mental health. They don't care about anything. You saw the doctors went for a strike a few weeks ago for almost like a month. Those are doctors in the fields of mental health, physical health. So like health is not being taken as a priority, and it
Okay.
should be.
But right now, do we have like a mental health like bill legislation being acted upon now?
Yes, it's there, but it was formulated in 2015.
Okay.
So the vision was up to 2030. Yeah.
Okay. What is it about?
It's about creating a framework where mental illness, or rather mental health, can be inclusive, like in all ways, where somebody in Madari can get mental services, healthcare services, someone in Runda can get the same healthcare services. You know, it's a framework whereby they want to make a holistic approach when it comes to mental health.
Okay, getting
Yeah,
those services and so
yeah, the
on.
services, but I don't think it's working.
And talking of those services, do we have like the toll-free lines like a person can call when he or she is depressed and maybe contemplating on suicidal
Suicide.
thoughts and so on?
Yes, Kenya has, and that's 1190.
Yeah, okay,
And
is it
then
really working?
it
Like,
is working.
okay.
Yes. And for those, the GBV survivors, you don't call them victims, we call them survivors
Okay.
to avoid victimizing them. So the GBV survivors, for the GBV survivors, it's 1195.
Okay.
So it's very much available, accessible, and they can get help anytime.
And what do you think has been the reason like for the rapid like when you see like the curve over the years, recent years, like it has gone up in matters mental health. What do you think might be the causes?
Okay. First of all, when you look at 2021, there was COVID.
COVID.
So the COVID period made a lot of people jobless, and that increased the rate of GBV because
Okay.
men and women, like husbands and wives, used to stay in the same house, confined together, and then the rate of GBV had an influx. Other things are toxic relationships. There's a rise in toxic relationships where you find
Okay.
where you
Okay.
find young people entering into relationships for the sake of it, and attachments. The moment you get overly attached to a guy or a woman you're dating, it causes depression, like in case he or she cheats or walks away. So the generation we are living in has a lot to deal with, especially drug abuse. It's also one of the major causes. Yeah.
All right. And then I have one question that have been sent by one of our crew members. He's asking, like, physical health in relation to mental health, because you say you cannot have a healthy mental health without a healthy physical health. How? What is the relation? Is it directly proportional or what?
I'd say it's directly related because when you look at it, like I said before, it's a holistic approach. One can't coexist without the other. Mental health can't exist without physical health, and physical health can't exist without mental health. They work together in a package. Yeah.
No. Yeah.
So I'd give a very good example. When somebody is suffering from, let's say, cancer, right? In the process of chemotherapy and all these things, obviously somebody will be stressed, they'll experience depression, they'll experience anxiety from time to time. So in that way, they're linked together. Yeah.
Okay.
And that's why in most oncology institutions where they treat cancer, you find that there has to be a psychiatrist there
Oh,
to walk
okay.
them through the journey.
Okay.
And they can't start treatment without seeing the psychiatrist. Yeah. And another example is the same way mental illnesses are, is the same way physical illnesses are. They're very similar in nature, in the onset, in how they manifest, and in different things. A very good example is diabetes.
Oh, yeah.
If you have diabetes as a person, you're not supposed to take sugar. There's type 1 and type 2,
Yes,
the
yes.
mellitus and insipidus. If you have diabetes as a person, and you're not supposed to take a lot of sugar. The moment you take sugar, it triggers it, right?
Yeah,
And it
correct.
increases the levels of glucose in your body,
Yes.
which can harm you. It's the same way with schizophrenia. You're not supposed to take cannabis. So the moment you take cannabis, it triggers you, and you get a relapse. So it's the same way. So you manage it by staying off some things. So physical health and mental health, they amalgamate to to form the perfect symphony that's health.
How does one now begin the journey of getting out of an emotional trauma?
Okay, I'd say it's tough, but it's not impossible. Nothing is impossible. It's the same. You go to hospital or a health facility, see a psychiatrist, and you'll get help.
Can you debunk this myth? Like you, like the psychiatrists are very expensive. Because once I was asked my like one session, like it's around 45 to 1 hour. Hey, at 10K shillings. Are you guys not expensive?
Well, what I can say is yes, we're expensive, but it depends with where you go. Some hospitals, it ranges from 5,000 to onwards, just like any other consultation fee for any other doctor. But the reason why it's expensive is because mental illnesses are very complex to treat. Before you diagnose it, before you actually get to know this patient is suffering from this, you'll send them for an MRI scan, an ECG test, different things. So that's why. But like your health is your wealth.
Correct.
So the same way you invest in other things, you should invest in your mental health.
So to to sugarcoat it, it's an investment. It's an
Yes.
investment. So we cannot say it's expensive, but it's an investment.
Yes, it is. But alternatively,
Yeah.
you can seek help from public institutions where they give
Okay.
it for free.
Oh,
Yeah.
okay.
Or you call the toll-free
Really?
numbers, seek help.
Like, can I be like you person be calling like because it's toll free? Because there's some people who are really idle. Yeah.
Yeah, it's toll-free. So you can call it if you feel like you have mental health issues.
I almost forgot one question. It's they are both like it's procrastination. People like who suffer from like because you are diagnosed it early on. It's one of it's a disorder, and also ADHD. How is it called?
Yeah, the attention
Yeah.
deficit.
Yes. How does it work, and how does a person overcome such?
The ADHD is more like it's in the same bracket as
You can be super focused, and you can.
yes, it's in the same bracket as dementia
Okay.
and autism because they're neurological disorders,
Okay.
right?
Yeah.
So for ADHD, it's really tough because it's the same thing I told you about the hyperactivity, you know. So for ADHD, they don't have a long concentration span. You can be here doing this right now, then after just 2 minutes, you're there doing something else.
Oh yeah.
So that's ADHD. But with the antipsychotics, you can be helped, or rather, coping mechanisms. You can be trained how to, like focus on one thing.
Procrastination.
Procrastination, I'd say it's something to do with your personality as a person,
Okay.
because we have different personalities. There's the phlegmatic, the melancholic, different personalities, the choleric.
So guys, I know those medical terms have slipped your head, but that's the beauty of it. And yeah, dictionary. Be a friend to dictionary, and also be a friend to a medical practitioner. Personally, what do you call it? It's a privilege to me because hey, apart from she's really my good friend, like hey, years of friendship. Yeah. We have a dub squad that is called the squad. Yeah, that you are both there. So I get counseling sometimes for free because it's expensive. Yeah, I know they say it's not expensive. It's an investment. It's an
Yes.
investment, guys. So so guys, I think I couldn't get a better guest for today to do justice to this show
Thank you.
rather than Doctor Who.
Diana.
Diana. I call her Nyanmia,
Yeah.
but you guys, it's me. You, it's Dr. Diana. And for any consultation work and so on, she's a professional doctor and uh, also work in hospitals and also in these community-based organizations. For if you want to reach out in case of consultation of or in case of any business, we'll just leave her email here, and you'll able to acquire her services. So as we close the show, it has been the point, and I've been your host, super host, man. Not just host, man, super host, Sebit Gordon, and my wonderful guest, Dr.
Dr. Diana.
Diana. All right, see you when you see me, man.